while I was in school, I got my CNA. I worked at all levels of nursing. Then I got my LPN, worked as an LPN for quite a few years, then got my RN, um, and then my BSN. And now I'm currently working at my doctorate degree, which I'm graduating next month. So I'm really excited about that. Um, I will say, nurses make decent money. We make livable wages. They have come up some from the pandemic, but I think the thing that's especially for, nurses and healthcare workers that are in, like, inpatient settings, um, the emotional toll, the physical toll, there's not really a dollar amount for that, and, um, nurse at least here in Washington, we're paid fairly well, not in all states, but also the responsibility and what we call the acuity of patients, like how sick patients are, has increased dramatically in the last 10, 15, 20 years, where, if you've had any kind of surgical procedure or a family member, like, they're trying to get you out and home within, like, 24 hours, right? Like, if it's some kind of a planned surgery, they don't wanna keep you for very long, and so now the people that are staying in the hospital tend to be really sick individuals with lots of what we call comorbidities or multiple different disease processes going on. Um, there are people that don't have a lot of resources, like they don't have a home to discharge. Maybe they have mental health issues on top of whatever, physical type of thing is going on. And so, and sometimes they're just not pleasant people. So they burned all their bridges. They don't have anybody to call to say, "Hey, I'm getting out of the hospital. Can I stay with you for a couple weeks while I, rehab?" And so these people get stuck in the hospital and there's no place for them to go. And, if you're the nurse coming into work every day and you have to deal with somebody who is yelling and cussing at you every day, plus they're very sick, and they need care, they need their wounds, dressings changed or medication and all these other things, it is really challenging. And so it's hard to put a dollar amount on, you know, what does it take out of you to work with somebody, especially, we should get hazard pay, honestly, because, we're dealing with lots of diseases, germs, the risk of like needle stick injuries, um, then a lot of physical violence. There's a lot of physical violence against nurses and healthcare professionals. There's finally some legislation going on that's, actually charging that with a crime, but, within facilities, they have their own policies on what is reported and how it's reported and how things go. So a lot of stuff, within that facility just never, you're discouraged sometimes from filing police reports for assault and different things. So it's hard to say that like the wages are proportional to all the stuff. And I think the public perception too, especially during the pandemic, I've been a nurse for, it'll be 19 years in May, a licensed nurse. And things have, a lot of things have changed. And one of the things with, I think the public, they don't realize the level nurses work at, whether it's a LPN, a licensed practical nurse, or a registered nurse. We're all licensed professionals. We've had to go through very rigorous schooling and then also take a national licensure board. And then we have to keep up with continuing education and things like that. But like I said, not a lot of people, they watch TV shows, like Grey's Anatomy, and they think that, the doctors are the ones that are taking patients around and walking them and feeding them because that's what's on TV, but that's not the case. If you're in the hospital, honestly, you're lucky if you see your physician or physician team 10 minutes a day while you're there. And nurses, we're taking care of patients 24/7. A lot of times, if when things are caught that, you could like go downhill, it's a nurse. And a lot of times it's actually a nursing assistant that's going to catch that because we're doing those hands-on care, noticing those subtle changes, and reporting them, assessing them, and that kind of thing. But when you watch on TV, it's always like the resident or the doctor is right there at the bedside, and they're like, "Oh my god, I know what this is," and that is, that is not what happens. So I think one of the things I try to do is, and nurses again back to that kind of like being a female profession and being socialized to not really brag about ourselves or talk about the stuff that we do, and also being overburdened with lots of things that you don't have time to like go toot your own horn or toot your profession's horn. You just got to get the job done, right? And so a lot of people don't realize. So it was very interesting in the beginning of the pandemic, 2020, we're healthcare heroes, right? And like That was the first time in my, pretty long nursing career that I mean, we were getting pizza sent, we were getting food sent, everybody loved nurses and healthcare people, and we were like, "Woo, woo, woo," right? And I gained so much weight that year because there was always treats and food, and I was like, "Wow, oh my gosh, people see what we're doing and, like, that we're, risking ourselves coming to work." And then, then there was lots of opportunities for travel nursing because of, you know, there were nurses that were getting sick, there were nurses that were dying, there were nurses that were leaving healthcare because they're like, I have health issues, family members have health issues or whatever. So there's always been travel nurses, but there was a big boon of travel nurses that were getting paid extremely well.